to Alate Health Presents. I'm Dr. Andrew Doe, a vascular and interventional radiologist at Alate Health, and with me is Dr. Michelle Manavis.
Hi, I'm Dr. Michelle Manavis, a vascular and interventional radiologist, also at Alate. Welcome.
Alate Health has been serving the Houston area for almost 8 years. Our original office was in the Museum District, and we will soon have a second office where we can see and treat patients for a various number of conditions. Dr. Manavis, can you tell our viewers what is a vascular and interventional radiologist?
A vascular and interventional radiologist uses minimally invasive treatments to treat a wide variety of conditions. What I love about our specialty is that there's no part of the body that we can't touch and make better. So, if you have cancer in the liver, instead of having chemotherapy and the entire body feels yucky and your hair falls out, we can travel through the blood vessel, find the exact blood vessel that's feeding that tumor, and just give chemotherapy to just that area. That's one of the cool things about our specialty. But specifically at Alate Health, we focus on a wide variety of disease processes, including women's health, men's health, and leg pain.
What types of patients would come to see us at Alate Health?
We treat all sorts of patients from their early 20s and onward. So leg pain can manifest at any time, especially venous disease. Varicose veins is very predominant in our community, and so we get patients that come in for sometimes just a single symptom. Maybe their legs feel a little heavy or their legs swell a little more at night.
Alate Health is one of the leaders in treating venous disease in the Houston area. We are the #1 center for the venous seal closure procedure. Why is it that Alate Health has been such a leading force in venous disease?
I think it comes from, one, word of mouth and continuing to produce successful, long-lasting results. And that's kind of what you get when you come to Alate.
Also, Dr. Manavis, can you tell us more about other conditions in the legs that someone might come to see Alate Health for?
Absolutely. So in our greater Houston area, our Houston demographic, Atherosclerotic Disease is a major condition that we see often. And what that is a fat and plaque builds up in the arteries. So you see this condition more often in the heart, and that's where heart attacks come from. But the exact same process can happen in your legs. So if you know someone that can't walk very far without their legs cramping or hurting, then that is definitely a condition to come to us for.
And at Alate Health, we offer the newest and most effective treatments for vascular disease or arterial disease, as Dr. Manavis explained it, in the legs. This will allow you to be treated, to feel better, and to be back to work and to an active life much quicker than, let's say, a surgical option. There will be no stay in the hospital. Actually, you're in the office for just a few hours of the day. So if you have any of these conditions, make sure you come and see us at Alate Health. Now, Dr. Manavis, how about some of the other conditions that we might treat as far as women's health?
So for women's health, we can focus on fertility or just the woman as a whole. One of the major things that we treat here at Alate are uterine fibroids.
So how many women might have uterine fibroids?
7 out of 10 women can experience uterine fibroids in their lifetime.
Oh, that's a lot of women. What exactly is a fibroid?
A fibroid is a benign growth of normal myometrial tissue from the uterus. So it's not cancerous, it's just an outgrowth of normal tissue.
Now, how would a woman possibly know she has a fibroid? What kind of symptoms would one expect?
The symptoms can really range, and it really depends on the person. But if anyone experiences dysfunctional uterine bleeding, and I mean painful cycles, heavy cycles, if you're using 10 pads a day, that's definitely a reason for us to start exploring uterine fibroids. Pain and cramping, abdominal bloating, pelvic pain, a lot of the women that come to us have anemia, so their blood levels are low because they're bleeding so much during their cycles. In addition, you can also get just run-of-the-mill symptoms like back pain and having to go to the bathroom a lot, constipation. These are more symptoms that are more difficult to pinpoint because we don't really know what exactly is causing it, but fibroids can also cause these more non-specific symptoms as well.
Now, I know you said this is a common issue with women. Is there any subgroup of women that this may affect more than others?
So studies have shown that there is a group of women that is affected. So that 7 out of 10 statistic that we talked about earlier, 80% of those women are African American. So there is a predominance in that population.
What ages or age ranges do you see these tumors affecting women?
So most of the women that present to us present later 30s and onwards, most of the time because they don't really know what's going on or they haven't had this condition explored. I do imagine that these fibroids have been present for longer. They just didn't know that something, warranted investigation.
So what kind of treatments are available for uterine fibroids?
So usually with treatments, we like to start off conservative. So medical management, and this is usually prescribed through your OB-GYN, hormones and pills that can help with the symptoms and help the fibroid, keep the fibroid at bay. There's other surgical options, a hysterectomy is a surgical procedure where they remove the entire uterus, or a myomectomy which is also another surgical procedure, but they remove just the fibroid itself, and ablation. And here at Alate Health, we offer a minimally invasive option that is non-surgical. That's called the UFE, the Uterine Fibroid Embolization.
Now, when you say minimally invasive, can you tell us more what that means?
That means the entire procedure is done through an IV. You've had an IV before, like in your wrist or in your arm? That's exactly what we do. We place that IV, except this time we put it into the artery into the right groin. And through that IV, we do the entire procedure. That's what we mean by minimally invasive.
And at Alate Health, this is all we do is minimally invasive procedures. So if you're looking to avoid surgery, regardless of the condition, you'd want to check out our website, www.alatehealth.com, and see exactly what treatments we offer, and you'll know that these are going to be minimally invasive. Now, Dr. Manavis, who can perform these minimally invasive procedures, such as uterine fibroid embolizations?
The uterine fibroid embolization is performed by a vascular and interventional radiologist. That means that we use x-rays and imaging to guide our minimally invasive procedures.
So this isn't something you would go and see your OB/GYN for?
It is not. So we usually work as a team with the OB-GYNs to find what is the best path for the patient, and it varies, for every single person. And so working as a team and being collaborative with other OB-GYNs is one of the things that we really strive to do here.
And at Alate Health, we strive to find complementary physicians such as an OB/GYN that will give the patient all of their options. And at Alate Health, we will always give the patients every option, and we will discuss with them any situation where some other option may be more beneficial. Can you give us one of those situations where possibly surgery would be more beneficial for the patient?
So for a hysterectomy, and that's the surgery where they remove the entire uterus, some women come to us and they just want it out and they don't want to deal with it anymore. And so a hysterectomy is what they turn to first. I will say, though, that there are 600,000 hysterectomies performed in a year. And a lot of women who come in, they'll know someone that had a hysterectomy and they'll say, well, they wish they knew about this option. So a lot of these are performed, but I wonder how many of these actually know that there are many options available to them.
And also, one thing that isn't commonly discussed with patients is patients who get a hysterectomy, a total hysterectomy, you're going to lose your ovaries, you're going to lose your estrogen production. And with our specialty, vascular and interventional radiologist, I always tell women that after 5 years since you've completed menopause, your risk for other vascular disease, such as heart attacks or blockages in the legs, will exceed that of an age-matched male. So these are things to consider before going through surgery, and it's always nice to have all your options. Now, with the uterine fibroid embolization, does this typically affect the ovaries?
So we don't usually embolize the ovarian arteries. Usually we find the uterine arteries that feed the fibroids, and we just kill the fibroids that way. There's a small subset of patients that will also feed the fibroids from the ovarian artery, and we really take those cases patient to patient.
Excellent. So, in summary, at Alate Health, we offer minimally invasive procedures which will allow you to get back on your feet. We treat a various number of diseases, and myself and Dr. Manavis have performed thousands of these procedures, and we would like you, if you're experiencing any of these symptoms, to follow up with us, whether it be through our website at alatehealth.com, or you can always call us at 713-955-1707. Thank you. We will take a short break, but be sure to stay with us as we'll discuss more after the break.
During the Cadillac Season's Best Sales event, Ron Carter Cadillac, Houston's only Cadillac to-your-door dealer, delivers 0% APR for 72 months, plus $3,000 bonus cash on both the first-ever 2020 CT4 Luxury Collection for only $449 a month, and the first-ever 2020 CT5 Luxury Collection for just $499 a month, both with only $1 down. Gulf Freeway, just 2 minutes south of the Beltway.
Shop smarter when you shop Ron Carter. Ron Carter, Cadillac.com.
Have you been injured in an 18-wheeler accident, truck accident, car accident? Was someone texting and ran into the back of you, not paying attention? It doesn't matter what it is. Give me a call, Attorney Willie Powles. We'll fix it today. The number is 281-881-2457. Again, that number is 281-881-2457. We'll fix it today. Call Attorney Willie Powles.
During the season's best sales event, Ron Carter Cadillac delivers 0% APR for 72 months, plus $2,500 bonus cash on all 2020 XT4, XT5, and XT6. Or drive 2020 XT4 Luxury Collection, only $299 a month. 2020 XT5 Premium Luxury Collection, just $369 a month. And first ever 2020 XT6 Premium Luxury Collection, just $399 a month. All for 39-month lease with just $1 down.
Ron Carter, Cadillac.com.
I'm Attorney Willie Powles. Allow me to express myself with you. If you've been hurt or injured in a car or truck accident, give me a call and we'll get it fixed today.
Welcome back to Alate Health Presents. Dr. Manavis and I were speaking about uterine fibroids. Could you tell us again how many women are affected by uterine fibroids?
Absolutely. So just a quick recap. 7 out of 10 women in their lifetime will experience uterine fibroids. About 80% of those are African American.
Now, treatment options for uterine fibroids.
So treatment options we went over earlier consist of conservative management, which is medications, and the surgical options, myomectomy and hysterectomy, and minimally invasive options, which we provide here at Alate Health, the uterine fibroid embolization, the UFE.
Now, why would one choose the UFE over a hysterectomy or myomectomy?
So every woman is different, and we try to help our patients pick the procedure that is right for them and their lifestyle. Women that pick the uterine fibroid embolization or the UFE want to go the minimally invasive route. So hearing that a big surgery is coming up for hysterectomy or myomectomy can be a little daunting. It can be a little scary. So hearing that we're doing an entire procedure through an IV sounds a little more, sounds like they can tackle that a little better than a big surgery. In addition, comparing the complication rates, with a big abdominal surgery, you can get complication rates as high as 30%, versus a minimally invasive approach where complication rates reported have been less than 1%.
Now, Dr. Manavis, how about recovery time? Is it the same as hysterectomy and myomectomy?
So I think that's where the procedures differ the most. For a myomectomy or a hysterectomy, the surgical options, the downtime can be as high as 2 months or 8 weeks. And for the minimally invasive option, the UFE, 1 to 2 weeks is what we usually say our patients should take off for.
I like to tell patients that the hysterectomy or myomectomy is going to be similar to a C-section, since most of our women have had C-sections. Would you say that's accurate?
Absolutely. You know, the recovery time is about the same for the C-section and the myomectomy, and also the pain level and the amount of pain that you experience in those 2 months is pretty equal from what our patients tell us.
Excellent. So we've talked about the treatment options, we've talked about uterine fibroid embolization, but who invented this? How did this come to be?
Gosh, I think that goes way past before I was born, Dr. Doe. Would you have any insights into that?
These veiled age jokes. Anyway, so the uterine fibroid embolization actually came about through collaboration in France between an OBGYN and an interventional radiologist such as ourselves. The OBGYN noted that these patients with fibroids, when he would do a hysterectomy, these patients would bleed a lot. And he asked his interventional radiologist colleague, could you slow down the blood flow to the uterus before I do the surgery? Now, slowing down blood flow or increasing blood flow, that's pretty much right in the wheelhouse of a vascular and interventional radiologist. However, they found that when he went in and slowed down the blood flow to the uterus, these patients with fibroids would come back a month or so later for their surgery, and a lot of them said, you know, I feel better. A lot of my symptoms are better, my anemia is better, my bleeding is less. Maybe I don't need the hysterectomy. So over the course of probably about 30 years, leading up to 2006 in the United States, which is when the uterine fibroid embolization was considered a first-line therapy for these patients. Now, Dr. Manavis, say a patient comes in to see us, and what can they expect going through the uterine fibroid embolization, kind of from start to finish?
So when they first arrive in our suites at Alate, they can expect friendly faces, so we will make them feel at home and make them feel comfortable. I think that's the most important part, is earning our patients' trust by making them know that they are safe here and that we're going to take good care of them. You'll meet all of our staff, including a nurse anesthetist, and she is very key in helping us through the procedure. So our patients are asleep the entire time. The procedure takes about 30-45 minutes, and I know there's been plenty of patients that have gotten IVs without going to sleep before, but we really want to focus on your comfort and really making sure that the whole process goes smooth. So we do put our patients to sleep for the entire procedure. Afterwards, they hang out with us for about 20 minutes, laying down flat, and after 20 minutes, we'll have them walk around, make sure they can walk around okay, and the patients leave shortly after that.
Excellent. So as far as pain control, how do these patients do with the pain, and what kind of pain is it?
So right after the procedure, the first 24 to 48 hours is the most painful, because the fibroids are very angry because we are killing them. So they're going to do the only thing that they know how to do, and that's to cramp. So the cramps can be very severe. I do hear from a lot of my patients, though, they've dealt with cramping almost their entire lives, and so at least this cramping is for a reason, and each time they cramp, a bit of that fibroid's dying. So we do, the pain medication that we give our patients is very specific. We have a very specific pain protocol that needs to be followed by the patient or a loved one, and that usually gets our patients through the tough 24 to 48 hours.
Excellent. So before the patient even has their UFE, what kind of processes may they have to go through?
So before we can even decide if you're a candidate for the UFE, we need to get an MRI of the pelvis.
So Dr. Manavis, the MRI, why do we need an MRI before we do a fibroid embolization?
We require an MRI before the procedure at Alate Health because it's a high-resolution 3D imaging tool that will give us a lot of information. So it'll tell us how big your fibroids are, exactly where they're located, what they're pushing up against. So like we said earlier, if a woman has constipation or they constantly have to urinate, we'll be able to see how much that fibroid is pushing up against these structures. In addition, the dye that they give during the MRI is the same dye that we give during our procedure. And so we can predict how successful we think a patient will be, and we can be upfront and realistic about what the outcomes are after the procedure.
Excellent. We can also see the size of the fibroids, and we can better give you an idea of what kind of pain to expect after the procedure, as well as any other things that may happen after the procedure. All of this information comes from the MRI, and although you may have had an ultrasound at your OBGYN's office or through your primary care, or some patients through the ER if they've gone in for heavy bleeding, the MRI is just a vastly superior test and will give us much more information, which will allow us not only to tell whether or not you're a candidate, but also predict how you're going to do after the procedure, which allows us to prepare for that and to treat you accordingly. Now, Dr. Manavis, the uterine fibroid embolization, the patients, when can they typically go back to a normal life?
So in normal life, really, they're limited only by how much pain they're in. The first 20 minutes is really all we require for them to lay still. The rest of it's really up to them. Most of my women are back up taking care of their kids and taking care of their family, going back to work within 3 days, the majority at the end of a week. We say 2 weeks, but it's very rare that someone hits the 2-week mark.
Excellent. So patients that undergo the uterine fibroid embolization, what do they typically classify or describe the pain like?
It really depends on the size of the fibroids and where they're located. Some of the women say they don't feel anything at all. And I will say that's one of the best phone calls that we get. You know, if we do a UFE on Friday, my favorite phone call on a Saturday is, "Hey doc, I'm not having any pain. I don't think I need this pain medication." So we have a wide range, and then some women have the big fibroids that are very painful. So with those patients, because we have the MRI, we really know what to expect. We can tailor the anesthesia medications, and we can help tailor their pain medications at home.
Now, if I or a loved one had uterine fibroids, had symptoms, and needed to get treated, how would I find Alate Health?
You can find us on our website. A quick search, Alate Health in Houston, will bring us right up.
Patients can also reach us by our phone number, 713-955-1707. And for patients that come in, is this covered by insurance?
So we work with a variety of insurance providers, and most of the time they do cover the insurance. We have wonderful staff that works with all of the insurance companies and you to work out a payment plan if needed, or to aid with the process to get this covered.
At Alate Health, we have dedicated staff members that will help you with your insurance coverage. They can even help you get insurance coverage should you qualify. Now, one thing I'd like to stress is you can see either Dr. Manavis or myself the first time with a free consultation. And again, that's at alatehealth.com. This is Dr. Michelle Manavis. I'm Dr. Andrew Doe, and you can reach us at 713-955-1707. Thank you for tuning in to Alate Health Presents. Be sure to tune in next week with myself and Dr. Manavis.
Until next time.